नमस्कार दोस्तों, वेलकम टू चैनल टॉक्सिकोलॉजी on will be discussing another important DABT topic, that is loxicillism. In that also we'll discuss other options like salmonella, salmon fish poisoning, synchronism, which is caused by cinchona bark, and concomitant torticollis, as well as mushroom poisoning. These are also other things which will be there in the options. Let's directly dive into the question. This question is taken from ABT Recertification 2000 question paper May 12. So the question is, loxicillism can result from. So we need to identify this type of syndrome is there, no? Loxicillism, it is caused by. It's a very bit direct question actually. If you know, there are different spiders are there. There a scientific name is there, by botanical name is there. So if we know that scientific name, we'll be able to identify the particular this type of toxicological syndrome. So we have option A. We have eating improperly prepared salmon. If the salmon fish is not prepared properly, so that is the first option. We have option B, we have spider bite. Option C, we have eating cinchona bark. Option D, we have any teratogenic insult with concomitant torticollis, and we have option E, which is eating mushrooms. So the right answer will be in the green text, that is nothing but your option B, which is a spider bite. So whenever this particular spider is there, that particular species we will be reading Loxellus recluse, brown spider it is commonly called. So that when it commonly found in the case of North America, whenever this particular bite of this particular spider is called loxoscelism. Okay, this was question which was asked previously. So this is a part in the case of the risk assessment. If you look into the DABT brochure, it comes under toxic agent plants and animals derived. Okay, so those who are preparing for the exam, no, those who are preparing either Clayson 9th edition or Clayson short textbook, I have given the page numbers. So please read page number 1293 in the case of ninth edition, or read page number 393 in the case of Clayson short textbook. So let's quickly go through what is the explanation which was given by the previous DABT students with respect to this question, how they have eliminated, how they have selected the answer. Loxalism is a condition produced by the bite of the brown recluse spider. I told you, know, because of the appearance probably of North America, and characterized by a gangrenous slough at the site of bite. Here you can see I have put the pictures for your understanding, and the symptoms which they are causing are nausea, malaise, fever, hemolysis, and thrombocytopenia. So these two important things are there. More severe one is hemolysis, as well as second one is thrombocytopenia, decrease in the platelet count. The term appears to be derivative of the spider's scientific classification. So this particular spider, it is called Loxoscelis reclusa. So this is given in the page number figure 26.23 something. It is given in the particular this chapter number under toxic agent plants and animals. So go back and see. Okay, so we'll quickly go through what are the important things which are given about this option B, that is spider A bite, on page number 393. Loxellus spider, or it is also known as brown or violent spider because of the appearance, I guess. The primitive spiders, okay, are variously known in North America as fiddle black spider or brown recluse spider. Okay, if you look into this one, no, primitive spider, if you look into animal classification also, no, you will come across this term with respect to monkeys also. Old world monkeys, new world monkeys. Okay, so in the classification of this particular animal species, no, so this comes under primitive spiders. So there also, whenever you will be reading about monkeys, you remember this old world monkeys, new world monkeys. Okay, coming back to spider, the venom of this particular Loxella spider, no, appears to contain, this is very important. I have in my video, in my channel also, I have kept about cobra spider, that cobra snake. The bite of this snake venoms also, no, they contain certain enzymes, they contain certain proteins or peptides. So you have to remember what is the nature of the that particular toxin. So with respect to the venom which is by this particular spider, no, it is containing phospholipase, it is containing protease, esterase, collagenase, hyaluronidase, deoxyribonuclease, ribonuclease, dipeptides, dermonecrosis factor, and sphingomyelin D. So these are the important things you have to remember. Certain times they might ask question. I am not sure they will ask, but certain times they might ask question. Then coming to the venom has a coagulation and vasoconstriction properties in the blood vessels or the blood. In the first also you have seen hemolysis is there, so it is causing coagulation, it is causing vasoconstriction properties, and it causes selective vascular endothelial damage. If you see in the blood vessels, this is the vascular endothelial membrane, this particular thing is also damaged because lot of these enzymes, if you look into phospholipase, protease, collagenase, hyaluronidase, these are all involved in your blood cell, the endothelial cell membrane function, everything. So because of this probably this either hemolysis or whether this disruption of this vascular endothelial might occur in the case of blood vessels. Then next we have, there are adhesion of these neutrophils to the capillary wall, to this capillary wall with sequestration and activation of passing neutrophils by the perturbed endothelial cells. So pros, go back, understand the mechanism how the endothelial cell damage occurs. So, okay, so in addition to that, we will learn this, the bite of this particular spider, no, Loxella spider, it produces about same degree of pain whenever there is ant sting is there, no, how you will feel little bit of sting you will feel, similarly you will be seeing with this particular spider. Means you cannot differentiate, the spider might come and bite you also, you will not be able to differentiate it. So certain time asymptomatic type of things will be there, they're more damaging. Okay, sometimes the patient may be unaware of it bite. If you don't take immediate action, there will be delay in treatment. It might, the poison or the particular venom might spread into your major organs in your body. Pruritus over the area, here you can see this one often occurs with reddening and elevated skin temperature. Increase in the temperature you can see, fever you will be seeing, hyperthermia, pyrexia, I mean to say, significant inflammation, hemorrhages may develop throughout the area, lymphadenopathy, here you can see lymphadenopathy, necrosis of the surrounding tissue, you can clearly see on the skin, on the area of the local site where the spider bite is there. Then if you look into the systemic symptoms, so whenever there is some kind of is there, you have to see what are the local actions, what are the systemic actions. Once the particular venom reaches into your systemic circulation, that is your blood vessels in your blood, what are the things, adverse effects you are seeing is fever, malaise, stomach cramps, nausea, vomiting, jaundice, spleen enlargement, hemolysis, and thrombocytopenia. So fatal cases, if you see, you have there it is very rare, but it is preceded by intravascular hemolysis, hemolytic anemia, thrombocytopenia, hemoglobinuria, and kidney failure. These are the, if the person dies from the spider bite, which is very rare, these are the things that you can, the reasons because of which a person might undergo death because of the spider bite. Immediate thing is that you go for the if you know, see these bites, no, you have to identify. Snake bite, you have two fangs or something. Scorpion bite will be there. Similarly, the spider bite will be there. You have to identify what is the organism which is there, what is the species. Then immediate antidote, some kind of certain type of treatments need to be initiated. Okay, so let's discuss option number A. It was eating improperly prepared salmon fish. So whenever contaminated salmon fish is there, if you consume that particular fish, what are the things that you will be see? So it is a foodborne illness. So we have, because it is caused by bacteria like salmonella, listeria, vibrio, staphylococcus aureus, like this will be zero, or it is caused by parasites like tapeworm and anisakis. So eating improperly prepared salmon fish risk to foodborne illness. So because either it is because of the bacteria or it is because of the parasites. And what are the important symptoms that you see? You will see nausea, vomiting, diarrhea, fever to severe complications. Okay. Um, and once you heat this particular salmonella fish up to 145 degrees or 63 degrees centigrade, no, most of the pathogens they will be killed. But once the toxins are there, no, in case of spoiled fish, no, still it will be remain and it will cause severe infections. So now let's discuss about. Before starting option C, I would also request try to read what are the different types of fish are there. Another type is there, like puffer fish is there. What are the important toxins which are released by the puffer fish, and what kind of symptoms it causes, that also you read, because it's a frequent topic for DABT questionnaire. They keep asking about that repeatedly, that about buffer fish poisoning also. So let's discuss option C. Option C was something related to eating cinchona bark. Cinchona, very simple. If you see, it is a if you go back and ask your mother, it will be there in your spices. Okay, it is there in your kitchen spices. It is a part of ingredient. Cinchona, a small bark will be there, which will be particularly in Indian foods. Asian foods, you can find this particular spice. A little bit of sweet taste, it will be there. So let's read what how this cinchona is causing, what type of poisoning is there. So we'll read about cinchonism also in this particular thing. So this eating cinchona bark is generally considered unsafe. This is as per the regulatory agencies. See, everything is unsafe until unless you eat consume in a proper dose. Anything overdose will cause poisoning. In case of similarly, in the case of cinchona bark is also same thing. It is considered unsafe as a medical treatment due to risk of serious. There are certain cases where they have found that this eating cinchona bark has caused fatality. Side effects from its high alkaloid content, primarily quinine and quinidine. This cinchona bark, it is containing quinine and quinidine. So I have kept these chemical structures also for you: quinine, chloroquine, hydroxychloroquine, and mefloquine. Some of you who had worked in the during the COVID time, no, you might have come across this hydroxychloroquine also was used for this to mitigating the risk or symptoms of this COVID virus also. So go back and try to remember about that thing also. And quinine, chloroquine are part of this anti-malarial drug also you will be using. So medical experts, if you see, and certain regulatory agencies, what they say, like US FDA, they say that eating this raw bark in overconsumption is not safe. That's what they say. And self medication of this particular bark should not be done. Because why they keep saying these regulatory agencies is that there are certain herbal drugs are there where where this cinchona bark might be a part of that particular herbal drug, but if it is consumed in overdose, it might cause high alkaloid content type of symptoms it will be causing. So next, what are the risk and side effects with respect to consumption of this cinchona bark? We'll see it will lead to high and unregulated concentration of alkaloids that can be toxic in large amounts. So they have given some amount also. So if you're taking 2 to 4 grams, it will cause severe poisoning, and 8 to 10 grams of consumption will cause lethality or fatality. So what is this synchronism that we will be reading here? Synchronism is nothing but overdose or prolonged use can lead to a condition called synchronism, which includes symptoms such as you will have ringing in the ears. Here you can see tinnitus or ringing in the ears, headache and dizziness you will be having. You will be having nausea, vomiting, as well as diarrhea, and you will have blurred vision. Okay, and there will be visual disturbances will be there, which can be permanent. So there may be permanent visual disturbance will be there even after the stoppage of consumption of the cinchona bark. And what are the heart complications are there? You can see it is having effect on irregular heartbeat. It can cause irregular heartbeat dysrhythmia, which is especially dangerous for individuals with pre-existing, if they are having any pre-existing heart conditions like long QT interval syndrome, a condition many people are unaware they have. So this is the thing. It is how the cinchona is affecting, having adverse effect on the heart. Then other serious adverse effects with respect to cinchona consumption are bleeding problems due to low blood platelet count. It causes kidney failure, liver toxicity, as well as severe allergic conditions. Okay, that was about the second option, that is cinchona. The first option we have discussed before, that is salmon fish. Okay, then we have discussed before that we have discussed about brown recluse spider. Now we will be discussing about option D. Option D is teratogenic insult with concomitant torticollis. So this is what some of you might aware or some of you not. Let's get introduced this particular terminology, that is concomitant torticollis. So explanation which is given: a teratogenic insult occurring during critical stages of embryonic or fetal development. So you have to understand, whenever you are doing embryo fetal developmental study, there will be segment 2 studies. There will be particular pregnancy window will be there, where it is much more sensitive. Any kind of xenobiotic exposure or chemical exposure to this sensitive window is there, no, it will cause some kind of teratogenicity, embryo fetal toxicity. So that critical stage you have to take care. So occurring during critical stages of embryonic or fetal development can result in congenital torticollis, which is nothing, another name is dry neck, as a part of broader clinical syndrome. The most significant teratogenic link involves substances or conditions that disrupt the development of this particular cervical vertebrae, you know that one. And in that also particularly one muscle is there, sternocleidomastoid muscle. Mastoid muscle is nothing but this muscle. Here I have kept for you people to understand. Okay, you can pause the video and see these pictures also. What is happening in the case of congenital torticollis is that chin point of this particular baby, you can see it is away from the contracted muscle. This is your contracted muscle, it is away in the opposite direction. This is your contracted SCM muscle, which is sternocleidomastoid muscle, and head tilted towards affected muscle. Wherever this muscle in the, like this, it is will be there. So here you can see right ear, tilt towards the right shoulder, and nose and face rotates to the left. Okay, so read about this one. It is also called twisted neck. Okay, so simultaneous occurrence of congenital muscular torticollis with another underlying mechanism where ocular eye issue or cervical spine, meaning twisted neck, will be there. So pause the video, you try to read in detail about this particular thing. Was about option D. Now we'll discuss about option E. So option E is about eating mushrooms. If there is any poisoning caused by eating mushrooms. See, mushroom is become is a one of the most frequently consumed food by most of the people around the world. But there are certain wild mushrooms, certain edible mushrooms, and certain poisonous mushrooms are there. So we'll be discussing about particular one or two types of mushrooms which have been mentioned in the Clayson textbook. Okay, which are poisonous. So we have two types there, two or three mushrooms there again. Sorry, I have already put the three figures over here. So we have Amanita phalloides, then we have Amanita fly agarica mushroom, it is called. So pause the video and read, or you can go back and refer to page number 387. So let's quickly go through what we can learn with respect to mushroom toxins. Most non-edible mushrooms may cause mild discomfort and are not life-threatening. So consuming this poisonous mushroom is not that much fatal. However, repeated ingestion of false moral Gyrometria esculenta has been found to cause hepatitis. So it is going to cause adverse effects on the liver. Then boiling generally when you cook the food, no, you cook the food at a higher temperature. This boiling will generally inactivate this particular toxin. What is the toxin? Gyrometrin. Most fatal poisoning related to wild mushrooms are from ingestion of different species within Amanita, Galerina, and Lepita. These are the three important: Amanita, Galerita, Lepita, that you have to remember. Particularly, Clayson textbook they have given about Amanita phalloides and Amanita agarica they have given. Amanita phalloides, here this particular figure 26.4, phalloidine and amatoxins. These are the important thing. Phalloidine is capable of binding actin in muscle cells. Here you can say actin, myosin fiber muscles will be there. No, not readily absorbed during in particular digestion, which limits its harmful effects. Since phalloidine cannot be absorbed through the GI tract, the adverse effects which are caused by this particular toxin is less. And these particular emetins, no, they exist in alpha, beta, and gamma, and are readily absorbed. Of the emetoxin, alpha emetin is the most toxic. Okay, it will inhibit protein synthesis in the liver cells by binding RNA to polymerase 2. Okay, so it also causes liver, intestinal mucosa, kidney are all affected by this particular within 3 days after ingestion of this poisonous mushroom, that is Amanita. Then in case of severe poisoning, liver transplant may be required. Amatoxin alpha, it will irreversibly inhibit acetylcholinesterase. Again, we have come across this particular enzyme, acetylcholine, and that neuron, synaptic junction, acetylcholine released from the vesicles, So, and acetylcholinesterase is the enzyme which act on acetylcholine. It will break into acetyl and choline group. So, this particular alpha, this amatoxin, it is inhibiting this acetylcholinesterase enzyme, because of which what happens in the junction, neuromuscular junction, no, acetylcholine levels will increase. Then you will have all cholinergic type of symptoms you will be having. So that you have to integrate like this, and you have to remember. Where else, whatever the examples you come across with respect to acetylcholine, acetylcholinesterase enzyme, you try to remember and read it. Okay, and these three mushrooms, so you don't forget, go back in textbook, also read alpha, this one, particularly what was the amanita species is there, no, Phi agarica mushroom, death cap, this you have to butter cap, this is a, I will tell you, this is deadly web cap, it is given. So go back and read. So hope from this video you were able to learn about, we read about salmon fish, we read about brown recluse spider, and we read about mushrooms we have read. So five options we have read. So have a quick revision. Thank you so much. Be curious. For any questions, please you can write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel Toxicology on the Board. All the best for your exam.